In the realm of music, few names resonate as profoundly as Billy Joel, a man whose timeless tunes have captured the hearts of millions. Recently, however, he made headlines not for his music, but for a medical condition called normal pressure hydrocephalus, or NPH. But what exactly is NPH, and how does it affect people like Billy Joel? Today, we delve into the science behind this intriguing diagnosis and explore how it influences those living with it. To understand normal pressure hydrocephalus, we must first look at the brain's complex makeup. Our brains are cushioned by a clear, colorless fluid known as cerebrospinal fluid, or CSF. This liquid flows through the brain and spinal cord, providing necessary nutrients and acting as a shock absorber to protect our sensitive neural tissues. Under normal circumstances, CSF is produced and absorbed at a balanced rate, maintaining a consistent pressure within the skull. However, in NPH, this delicate balance is disrupted. For reasons not yet fully understood, the brain can start to transport more CSF than it can absorb, or experience restricted flow, leading to an accumulation of fluid. Despite what the name suggests, this doesn't typically cause high pressure within the skull. Instead, the ventricles, small cavities in the brain, gradually enlarge to accommodate the excess fluid, often without causing the pressure spikes seen in other forms of hydrocephalus. The condition is termed normal pressure because standard diagnostic tests may not register heightened pressure within these ventricles. This gradual swelling can lead to a triad of symptoms commonly associated with NPH: difficulty walking, impaired bladder control, and cognitive challenges such as memory loss or confusion. These symptoms can be subtle at first, often resembling those found in other conditions commonly affecting older adults, like Parkinson's disease or Alzheimer's. This resemblance can make NPH challenging to diagnose and even more challenging to differentiate from other neurodegenerative diseases. Modern diagnostic approaches typically involve a combination of clinical evaluations and neuroimaging techniques, such as MRI or CT scans, to observe and measure the enlargement of the brain's ventricles. An effective and more direct diagnostic test for NPH is the lumbar puncture, or spinal tap. By withdrawing some cerebrospinal fluid, doctors can temporarily relieve symptoms, a positive response often pointing toward NPH as the underlying cause of a patient's struggles. Even with an accurate diagnosis, the journey with NPH can be complex. Treatment often involves the surgical insertion of a shunt system within the brain. This shunt helps redirect excess fluid to another area of the body where it can be more easily absorbed. Despite the promise this solution offers, shunting comes with its own set of risks and challenges, from infection to shunt failure, requiring careful monitoring and occasional revision surgeries. Interestingly, though, individuals like Billy Joel, who share their journey with NPH publicly, help shine a light on this condition. They raise awareness about the disorder, potentially driving research and fostering greater understanding and empathy. Celebrities can bring unique attention to medical conditions that, in turn, inspire those affected to seek accurate diagnoses and appropriate treatments. In conclusion, understanding normal pressure hydrocephalus, particularly through the lens of Billy Joel's experience, provides a fascinating insight into the human brain's resilience and vulnerability. While the symptoms of NPH can indeed be challenging, advancements in diagnosis and treatment offer hope to many. With increased awareness and ongoing research, those living with this condition might continue to lead fulfilling lives, contributing to their communities and beyond. And so, as we continue to unravel the mysteries of the human mind, each story inspires a broader dialogue, pushing boundaries and expanding our collective knowledge. Whether on stage or off, voices like Billy Joel's guide us not just through musical journeys, but through the intricate symphony of science and medicine.